you have a history of heart attack, stroke, or a transient ischemic attack, your LDL levels are above 190 mg per deciliter, you are older than 40, and you have diabetes, hypertension, and maybe a smoker, well, the short answer if you should consider statins is a yes, and I will tell you why. In the grand theatre of modern medicine, statins emerge not merely as players but as stars in their own right, casting long shadows across the stage of cardiovascular care. With the elegance of seasoned performers, they waltz into the bloodstream, each molecule a tiny dancer poised to lower the sinister, bad cholesterol and stabilize the volatile plaques that threaten the very essence of life. Under the spotlight, statins take center stage, reducing the risk of heart attacks and strokes with a deftness that belies their chemical nature. They are the vigilant guardians of the cardiovascular realm, keeping the dark forces of atherosclerosis at bay. As they weave through arterial pathways, these medicinal maestros lower LDL cholesterol, much like skilled arborists pruning dangerous overgrowth to prevent the disastrous blockades of blood flow. Beyond their cholesterol crusade, statins act as diplomats in the volatile world within our veins. They stabilize the arterial plaques, silent yet deadly threats that, if left unchecked, could rupture and unleash chaos in the form of heart attacks. This peacekeeping role transforms potential tragedies into tales of triumph, preserving the rhythm of beating hearts across the globe. Statins also play the role of sages, imparting wisdom to the inflammatory processes that underlie much of cardiovascular disease. Their presence soothes the inflammation that can erode arterial integrity, thereby extending their protective mantle beyond mere lipid management to guard against the insidious creep of atherosclerosis. However, not all is quiet in the audience. Whispers of dissent murmur through the crowd. Statins, for all their stardom, are not without their detractors. Muscle aches, the specter of diabetes, and rare but serious liver issues form the basis of a subplot filled with intrigue and caution. These side effects, like unexpected plot twists, remind us that even stars are not immune to fallibility. The plot thickens as statins interact with other medications, a complex dance requiring precise choreography to avoid missteps that could disrupt the show. This act reminds us of the delicate balance required in the polypharmacy that defines much of modern treatment paradigms. As the curtain falls, the narrative of statins extends beyond the confines of pharmacology into the realms of lifestyle and diet. The audience is reminded that while statins are formidable players, the stage of health is vast, and the most enduring performances involve more than medication alone. Diet, exercise, and lifestyle changes are the supporting cast that, together with statins, can lead to a standing ovation in the drama of life. Thus, the story of statins is both a personal and a medical odyssey. Each patient, guided by the wisdom of their physicians, must navigate their own path through this complex landscape, balancing the potent benefits of statins against their potential risks. It's a narrative written in the language of life itself, a story of choices, challenges, and ultimately, the quest for a heart-healthy finale. In this grand drama of medicine and molecules, statins play a role that is both crucial and complex, interwoven with the very fabric of human health and the perpetual quest for longevity.